Hello, and welcome to today's episode of the Gynobits podcast. I'm your host, Dr. Susie Weber, board-certified gynecologist and menopause specialist. On the Gynobits podcast, we'll cover women's health issues with a focus on menopause, vulvovaginal conditions, and sexual health. Welcome to episode 2 of the Gynobits podcast. Today I was going to talk about the difference between menopause and perimenopause and discuss some common symptoms of perimenopause and things that can be done. I don't know about you guys, but when I was in the 4th grade or maybe 5th grade, they took all the girls at our school into the library to show a movie. It was probably on one of those old-fashioned projectors about the menstrual cycle. And this was our introduction and our briefing on what was going to happen when we started our period. I recently had a friend say that we should bring all of the perimenopausal women into the library again to talk about what perimenopause is and how to navigate menopause, because there is just no real education or preparation for this time in our life. And I just thought that was fantastic and spot on. My other thought was that we should get Judy Blume to write a book about menopause. Something like, Are You There, God? It's Me, Margaret. I'm going through menopause, or perimenopause. Then all of the women in their mid-30s and older could read this book and get some information. Menopause itself is easy to define. So menopause is the point in time when we have not had a menstrual cycle for 12 months. Perimenopause is this murky gray zone where for 5 to 10 years before your menopause, you can have a lot of hormonal fluctuations and changes in your body and health. And I say it's murky because there's no blood test to tell you that you're in perimenopause. And some women are going to experience a lot of symptoms 5 years before their menopause, and some women really aren't going to have a lot of symptoms. The other thing that's challenging is sometimes when we are perimenopausal in our 40s, we may be having other health conditions, and they could be related to our hormones, or they could be completely separate. We're also frequently in the busiest, craziest season of our lives. We're likely working full-time. We may be raising our kids, and we may be starting to care for aging parents. There is a lot going on for us. During perimenopause, there is a decline in estrogen levels, but some months there is an increase in estrogen levels. It can be quite the hormonal roller coaster. And that is why if you are perimenopausal, meaning that you're still having menstrual cycles, sometimes your menstrual cycles are going to be closer together, longer, heavier. You may have more PMS type symptoms like breast tenderness, irritability, and moodiness before your menstrual cycle. You may also be starting to see more hormonal acne the week or so before your menstrual cycle. I always think it's so unfair when we get to perimenopause, especially if you're in your late 40s and you have wrinkles and acne. It sucks. Pick one. If you're getting later in perimenopause, you may be starting to skip menstrual cycles. In fact, if you're going more than 60 days in between periods, you are at the end of perimenopause. We still don't know for sure. We can't pick a date when you'll be menopausal, but we know that that is toward the end of the perimenopause road. Because of these hormonal fluctuations, there really are no blood tests that tell you when you're in perimenopause. We could check your hormone levels 1 month, and they could be in a certain range, and they could be different the next month. 99% of the time, they're likely going to be in a normal range. And that is what is frustrating for some women, because they'll go to their primary doctor or they'll go to their regular gynecologist, and they'll mention that they're having all kinds of symptoms, and their doctor will draw blood work and say, nope, you're normal. All of your levels are normal. But that is really what we expect, and that doesn't mean that you can't treat your symptoms. After menopause is when we would really expect to see changes more consistently on the blood work. After menopause, especially if you're having hot flashes and night sweats, my guess is that your estrogen level is going to be super low. Your progesterone is going to be non-existent. Your testosterone level, it could be normal or it could be low. When we are premenopausal, our ovaries are our primary source of testosterone. After menopause, the adrenal glands will make up for that, and they will be making our testosterone. So what are some symptoms of perimenopause? Frankly, what isn't a symptom of perimenopause? I think it's crazy because I think we're starting to see that our hormones can affect a lot of different aspects of our health. And so women are starting to talk about their perimenopausal symptoms and we're finding that a lot of women are having some kind of odd symptoms. But once they go on hormone therapy, a lot of times these symptoms can get better. The most common symptoms are generally vasomotor symptoms, and vasomotor means hot flashes, night sweats. A lot of women get sleep disturbances. They have difficulty either falling asleep, or very commonly they might wake up early in the morning and have difficulty getting back to sleep. Menstrual irregularities are very common. A lot of times earlier in perimenopause, you will be having menstrual cycles that are getting closer together. So if you count from the first day of one menstrual cycle to the next, it could be 21 days, which seems really short. You have a menstrual cycle, might last for a week, and then 2 weeks later, bam, you're having another period. A lot of women will also find that their cycles are extremely heavy, crampier during this time as well. Like I mentioned, it can be common when you're getting later in perimenopause to actually skip cycles and go longer in between. And this happens because you are not ovulating every month. Ovulation refers to releasing an egg every month. If that egg isn't fertilized, then 2 weeks later, you get a menstrual cycle. However, in perimenopause, we do not always ovulate. So we can be making hormones and getting breast tenderness and crampy and feeling like we're going to get a menstrual cycle, and then we don't ovulate and we don't get a period. If you are having abnormal bleeding where you are getting a menstrual cycle closer together than 21 days, or they're lasting longer than a week, or you're bleeding for a week, stopping for a week, bleeding for a week, or they're extremely heavy, heavier than you've ever had, then it's always best to follow up with your gynecologist just to make sure you're not missing anything that could be coming from inside the uterus, like a uterine precancer or cancer. But if your cycles are generally a little bit shorter, a little heavier, a little longer, a lot of times that can be normal for perimenopause. Perimenopause is also another time in life where we tend to see more women getting hysterectomies. There are a lot of medical treatments for bothersome menstrual cycles, but some women have contraindications to being on hormones, or they have other reasons to have their uterus removed. In the perimenopause, a lot of women get worse premenstrual symptoms. They get very irritable or ragey before their menstrual cycle. This is also a common time when we see a lot of increase in anxiety, especially if we are prone to anxiety or depression. We tend to see these conditions worsen. Decreased sex drive can occur for some women. Weight gain is a very common complaint that I see in my clinic. I know that every time I go to the doctor, my weight is increasing. We also tend to get more fat deposited in our abdomen instead of our hips. We can get mental changes that we refer to basically as brain fog. Sometimes we have difficulty focusing or concentrating. We also tend to think that we're really good at multitasking, but we're not. Some women will get heart palpitations. Other women will get more body aches, joint pains. Our hair growth patterns can change, so we can get more hair loss from our head, and then we can get chin hairs, or what I like to refer to as werewolf hairs. We also get changes in our skin. Declining estrogen levels lead to decreased collagen in our skin, so our skin can get saggy. It can be also more prone to bruising and slower healing. This can affect the skin in our face, all of our body, including our vulvas. Some women will also get a lot of vaginal dryness and discomfort with intercourse in the perimenopausal period, and this tends to get worse the farther out from menopause we are. Then there can also be some different symptoms. I haven't seen too many women talk about change in taste or have tingling limbs, but I have heard that from some women. A lot of our symptoms can be attributed to changing hormone levels, but we have to also look at our lifestyle critically and see what other things are going on that can affect our overall health, physical, mental, emotional. When a woman comes to see me to talk about her perimenopausal symptoms, I usually talk to her about her lifestyle. So we talk about what type of diet she's keeping. We also talk about her sleep quality, her activity level, including high intensity exercise, strength training. We talk about areas of stress in her life and her social support systems. We talk about supplements that may help with some of her symptoms, and we talk about hormonal therapy. So we talk about prescription, FDA approved prescriptions that she can take and the risks and benefits of those. We also talk about non-hormonal prescription treatments, and we talk about local vaginal hormones if she's really just having vaginal dryness and changes there. Talk about vaginal moisturizers, lubricants. And we talk about the off-label or out-of-the-box supplements and treatments that she can try as well. And we talk about the risks and benefits of all these things. In general, with regards to diet, I don't think there is a perfect diet. I don't think paleo, keto, I don't think any diet is quote unquote perfect. I don't think that there's any diet that is perfect for each woman. And the most important thing is to pick an eating plan that is sustainable for you. For me, it's not sustainable to do intermittent fasting or super low carb. Some women do very well with these types of plans. There are a lot of apps where you can map out how much weight you want to lose and how much you weigh and what your activity level is, and you can create a plan that has a small calorie deficit so that over time you will lose weight. Something like the Mediterranean diet, where you are eating lean proteins, limiting red meat, eating good fats like avocados, olive oil, and getting a lot of fiber with fruits and vegetables. I think that is the healthiest, well-balanced diet. It's also a good idea to increase your fiber. So for a woman, more than 25 grams of fiber a day, that can help keep you regular, make you feel full, and can help with decreasing colon cancer risk. Getting good sleep is so important. I know if I am tired, I am going to probably eat poorly, and we know that over time, fatigue contributes to an increased risk of things like high blood pressure, heart disease, stroke, not to mention increasing your risk of getting in car accidents and poor mood, depression. Sometimes it can be really challenging to get good sleep in the perimenopause, and sometimes that's because we don't want to go to sleep. We are with people all day long, taking care of other people, and sometimes we just want some time to ourselves. And I know sometimes I find myself reading or scrolling or just laying there wanting to just enjoy time to myself. Other times, hot flashes or night sweats can keep us from getting good sleep. So if you are having night sweats that are waking you up every hour at night, my God, of course you're going to be exhausted, and that is terrible over time. So you could consider treatments for your night sweats, and that would likely impact your sleep in a positive way. Exercise, I don't think there's any downsides to exercise ever unless you are overtraining or overdoing it. We need exercise that gets our heart rate up for our overall cardiac health, and we also need exercise that keeps us strong and flexible. So I like to vary my workout routine. So a couple days a week I'll do more cardio. I like to wear a heart rate monitor, then I can see where my heart rate is and track my calories. And 2 other days a week I like to do resistance training, and I lift weights, I do squats, I do lunges. And I think that really helps, especially as we get older. I don't know about you, but when I squat down to pick something up, it's hard to get up from that position sometimes. Plus, we need to maintain our lean body mass, our strong muscles, because this is going to help us by protecting us from bone loss. And bone loss can lead to osteoporosis, and osteoporosis can lead to fractures, and boom, fractures can lead to pain, reduced quality of life, and death. Stress reduction can also be very helpful, but that's sometimes hard to do. And if you're type A like me, there's only so many things you can do to reduce your stress. A lot of women find things like meditation, yoga can be very helpful at reducing their perceived stress. Social support is a big thing too. The happiest people in life are the people that have good social support. And unfortunately, sometimes when we get older and we have our own families, we feel like we don't have time, or maybe we can't take the time to just be with our friends. But finding support outside of your family can be very beneficial. I know this is an area in my life that I've struggled in because I have not, as an introvert, been super outgoing, but I always think, man, I wish I had me more of a chick posse. So that is one of the things that I am working on in my life, among other things. I feel like I am a work in progress always, but I do believe in progress and not perfection. I hope this information has been helpful. I appreciate you tuning into the podcast this week. Next week, I am going to talk more about supplements and prescriptions for our perimenopausal symptoms. If you enjoyed this podcast, please like and subscribe and mention it to your friends. Thank you. Thank you for joining me for today's Gynobits podcast. If you like this podcast, please like, subscribe, and share. Just a reminder that this is not medical advice and you should consult with your personal physician. Also, the opinions and views are mine only and do not reflect those of my employer. If you would like more information or to consult with me, please go to my webpage, healthiermenopause.com. You can also find me on Instagram at healthiermenopause and Facebook, MenopauseMD.